Hi everyone, Dr. Chelsea here with Treasure Valley Pelvic Health, and today I want to talk about scar massage and how this is a highly overlooked area of care for women after having a cesarean delivery. So keep watching and learn all my tricks that I tell patients on how to make themselves more comfortable and eliminate problems after having a cesarean. If this is your first time joining me, I am a pelvic health expert and energy medicine practitioner. As I said, scar massage is something that is highly overlooked for women after having a baby. Now, this is something that can be done many years after having a baby. It doesn't have to be in that early healing phase. I've worked with women decades later where they've been able to make some really great changes and improve the comfort in their body after working on the scars properly, like I said, even decades later. If you have just had the baby and are still healing from the cesarean surgery, you want to make sure that you don't do this until the scabs have fallen off. Though if you are uncomfortable around the incision site, you can really take some time and do some very gentle tissue mobility, as I'll describe here shortly. Now, the first place to start for women who are still pretty early on in their healing journey after having a cesarean is skin desensitization. So what this is simply taking your hand and just lightly rubbing that tissue. It can be very sensitive for some women, and sometimes just getting the brain and the nerves to calm down and kind of reacclimate to touch or clothing rubbing on it can be a big step in their healing journey. So taking about 3 minutes a day, whether it be when you first wake up or when you first crawl in bed, and really gently spend some time just gently rubbing against the skin of the abdomen. Now, if you're having more discomfort than just skin level, you can start to sink in a little bit, still staying away from the direct incision site here, but we can really gently begin to move the tissue of the abdomen around so that we can create just a little bit less tension from that incision site. If we think about, I always like to use my shirt here, but if we think about it as a pucker, you can see if I pull this in tighter, it starts to pull all the way to my one shoulder as well as from the other. So we have to create good mobility so that it doesn't pull on all of the adjacent tissues. Now, if you're a little bit further out from having your baby, we want to get a little bit more firm and aggressive with our scar massage. I really think it's important to know which directions of the scar and the tissue are restricted. So really just taking some time and sinking your fingers along the scar like you're playing piano, right? So make sure you expand through the whole width of the scar, but even beyond the scar. Scars have gotten shorter in length. However, the tightness can extend all the way to the sides of the pelvis. So just expand your fingers so that you're going from one side of the pelvis to the other side of the pelvis. And with this, then you're going to gently pull the tissue upward towards your belly button and then downward towards your pubic bone. You're going to go up and down, side to side, but I also like people to do little circles, and you can do one hand at a time. That is just fine. With this, we're really just taking in information as far as where we want to focus our scar massage so that we are more effective with our efforts. So we have to think about all of the layers that we have to address with scar massage. We're going to stay pretty superficial, at least for the first little bit, and we're going to really just do the side to side, up and down, or circles, whichever direction you find the tightest. I want you to take it into that. There can be some discomfort, but it should not be painful. There might be just a little bit of stinging involved, but again, there should be no blood. There should be no lasting discomfort. Along the same lines as just finger placement, if you're working with one hand, you don't want to neglect each side of the pelvis. So make sure you're working your circles or your up, down, hearts, stars, smiley faces, whatever direction of movement you are doing. I want you to make sure you do that from one side of the pelvis to the other. And with this, you want to just stay a little bit superficial for now and then gradually increase the pressure like you're just sinking into a sponge as it gets softer and softer. You might find as you sink deeper into the layers of the tissues that the direction of tightness begins to change. So don't just assume that it's going to be the same to the deeper layers as it is on the superficial layers. Now we can sink all the way down pretty firmly down into the abdominal organ, into the uterus itself. So we want to make sure that we have good slide and glide between the bladder and the uterus. This is important because if we don't, we create problems such as bladder urgency, frequency. I've had women who have had pain with their menstrual cycles. I've had pain with deeper penetration, chronic low back pain, all simply from restrictions in the scar. So this is why it's so important to make sure that we do scar massage. Now, in general, I encourage people to start with doing scar massage about 3 to 5 minutes, 1 to 2 times a day. If it's really sensitive, maybe start with just 1 time a day so that you're not overly irritating it. Maybe the second time a day, you start with that gentle desensitization of the skin. As things improve in mobility, and this is true even if it's a decade later, but as things improve, then we can start to decrease how much we're doing the scar massage each day or each week. So in general, again, once a day, I would say at minimum, and then as things improve, decrease to maybe twice a week, and then maybe every other week, to then once a month, and maybe once every 6 weeks. I would encourage you to do this at minimum once every 4 to 6 weeks while you're continuing to make change, again, so that you can maintain the gains that you've worked so hard to achieve. The scar and tissue can continue to be formed for up to 2 years for some people, and even I've had a handful of people who are beyond that. So it's imperative to continue with this scar massage technique for quite some time after having your baby. Now, one of the most important things that I think people need to understand is that if you are sore from doing the scar massage more than 30 minutes after doing it, or when you come back to do it again the next time, you were too aggressive. We want to be aggressive and create change within the tissues, but we don't want to create harm or create a stress response in the body. So you need to be able to monitor this. More is not better. So really be kind to yourself, though we're trying to be a little bit aggressive and make some good change here to make you a little bit more comfortable and minimize symptoms, but we do need to be gentle to ourselves. There you have it, folks. Those are my key tips for doing scar massage and why it's so important. Let me know if you have any questions down below, and I'm here to help you succeed. Have a great one.